I'm an ex-nurse and I'm really concerned about the pressures that the women working in this hospital are under, and I'm really interested to know if you have any policy ideas or any views on how that can be alleviated, because nurses are leaving the profession and they're not being replaced. So what will you do about that?
Look, everyone is asking a very similar question about our hospitals. Everyone is sick of the waiting times and they know that the staff aren't to blame. They're doing everything humanly possible. The problem is there's not enough of them and we don't have those basic conditions. The nurses and midwives, through their union, have a wonderful campaign called the Ratios Campaign. And what they're asking for is 1 in 3 in ED, and as I understand it, 1 in 4 for the rest of the floor. And I don't think that's a big ask if you consider not only the pressures but the responsibilities, as you well know as an ex-nurse, in emergency, and the things that they have to do and the things that they're expected to do. 1 nurse for 3 patients should be an absolute minimum. And I can't understand why governments, both persuasions, hadn't already done it. I will be voicing a very, very strong vote of support for the nurses campaign. I think that is one that is shared by our entire community. And if I can, as an independent voice and an independent watch on this hospital, ensure that the voices for the nurses, the midwives, the doctors and the other health professionals, as well as the patients that they're doing it for, have an independent voice in Macquarie Street, I will be doing that. This means more than just a promise. It means keeping the campaign going. As we know, politicians promise a lot of things, and sometimes you get them and sometimes you don't. But this is too important to leave to chance, which is why I'm saying that if I am elected, I'm not stopping on election day. I will keep going all the way through and reporting back into Parliament every day on how this place is going in meeting those ratios and ensuring that patients don't suffer. That's the least we can do. Yes, that may mean more resources, but the beneficiaries are us as a community. We are all patients of these hospitals at some point in our lives. We are doing this for ourselves. That's what makes this such an important campaign that the nurses and midwives have been leading, and why it's incumbent on everybody, not just politicians, but everyone in the community to get behind it. There are other issues too, however, and obviously the onslaught of privatisation, of the pressures on our public health system, where some people are in it to make money. Most of us see our hospital's primary function to actually help us as a community, patients. It's for the sick, not for the profiteers. And yet these are the pressures that are squeezing our health system. We know from overseas and in various places where these evaluations have been done, the private systems are both more costly, less efficient, and don't provide the same outcomes in public health. We don't need them here. The third thing that we need to do is to actually look at the prevention of some of these problems. Our community health centres and outreach and the wonderful work that had been done for decades has come under attack by the bean counters. They are actually saving money in areas where they're actually standing in the way of healthier solutions before people even need emergency departments like this. Not only does it not help our health system, our public health outcomes, it's also more costly in the long run. It doesn't make sense. Health is up there in the people's minds for a very good reason, because it is one of the most important part of our lives, and if we can't take care of our public health system, we're just not in the game.